Welcome to our NPTE Question of the Day series presented by Typical PT. Today, we are going to be discussing a question from Typical PT's platform. Let's jump right in. During a review of systems for an upcoming session, a physical therapist notes that a patient's hemoglobin level is about 7.8 grams per deciliter. Question: what symptom is typically not present in a patient with these findings? Let's read the options. A. Increased diastolic blood pressure. B. Yellow-tinged skin, conjunctiva. C. Dyspnea. D. Chest pain/heart palpitations. Go ahead and pause the video right now, think through the logic, and lock in your answer. When you are ready, hit play again to see the solution. The correct answer is A. Increased diastolic blood pressure. A hemoglobin level of 7.8 grams per deciliter indicates anemia. With anemia, blood carries less oxygen. To compensate, the heart works harder to deliver oxygen to body tissues. This increased cardiac workload can elevate systolic blood pressure, heart rate, and respiratory rate. However, diastolic blood pressure does not typically increase in anemia. That is why increased diastolic blood pressure is the symptom that does not fit with this patient's presentation. If we look at the common signs and symptoms of anemia shown in the table, they include fatigue, weakness, pallor of the skin, nails, and conjunctiva, shortness of breath on exertion, tachycardia, palpitations, dizziness, headache, chest pain, cold intolerance, difficulty concentrating, restless legs, pica, brittle nails, hair loss, and glossitis. Once again, increased diastolic blood pressure is not part of the typical symptom profile. Now let's connect this to the lab reference diagram from the Physical Therapy Essentials textbook. Normal hemoglobin levels are: males, 13.5 to 17.5 grams per deciliter. Females, 12 to 16 grams per deciliter. Values below normal indicate anemia. The exercise guideline shows less than 8 grams per deciliter, no exercise. 8 to 10 grams per deciliter, light exercise only. 10 to 12 grams per deciliter, low-intensity exercise with some resistance training. Since this patient's hemoglobin is 7.8 grams per deciliter, this patient falls into the no exercise category, confirming that the anemia is significant. Now, let's go over why the other options are incorrect. Answer choice B, yellow-tinged skin, conjunctiva, is incorrect because yellow-tinged skin or conjunctiva can be seen in certain types of anemia, such as hemolytic anemia, due to increased red blood cell breakdown and bilirubin release. Answer choice C, dyspnea, is incorrect because dyspnea is a typical symptom of anemia, caused by reduced oxygen delivery to body tissues. Answer choice D, chest pain/heart palpitations, is incorrect because chest pain and heart palpitations can occur when the heart works harder to compensate for low hemoglobin levels. So, to summarize, anemia leads to decreased oxygen delivery. This causes dyspnea, palpitations, chest pain, fatigue, and pallor. But it does not typically cause increased diastolic blood pressure. That is why the correct answer is choice A. Now that you've gone through this case, take a moment to jot down all the key points in your Typical PT digital notebook. Use it to organize your notes, highlight concepts you found confusing, or mark areas you want to review later. This feature isn't just for note-taking. It can serve as your personal reviewer, helping you track what you've mastered and identify topics you still need to strengthen, ultimately improving your retention and understanding. Thanks for watching today's Question of the Day. We're dropping new NPTE prep content every single day to help you pass with confidence. Follow us on Instagram, Facebook, and TikTok at TypicalPT for daily study tips, quick reviews, and motivation to keep you going.